Putting live you in few seconds. So I'll give you I'll intimate you. You are live.
Thank you very much. And thank you everyone for joining us. And this program of today, this webinar of today is very, very special. It is special because of quite a few reasons. We have our upcoming conferences which come up, and the importance of being present in the conferences is important to so many of us. The different sections that deal with the presentations, the free paper, the instruction courses, the videos, the poster presentations, all of them have great importance in and as scientific presentations, not only in the national scenario, but as well as in the international scenario. And to get a possibility of a presentation in the different national conferences, as well as the international conferences, we need to submit abstracts of work that has been done, that has been painstakingly done over at times months, over at times years. And everything culminates to a presentation that is going to be in a national or an international scenario during a conference. But what gives the cue? What is the gateway to a national or an international conference presentation? It is the abstract. The abstract that is submitted as a free paper abstract or an instruction course abstract or a video abstract is judged by evaluators all over, and that gives the chance for the presenter to get his or her abstract accepted. And this is the importance of the abstract, which is in a limited word format, and it goes out to a large number of evaluators. On the basis of the evaluation, the abstract is accepted or rejected. So today we are here to discuss what makes an abstract a good abstract and what gives this abstract the possibility of getting accepted. And where are the flaws and faults when it is not accepted? So here we have today, and I will request our chairpersons to be with us, and we have the governing council members who have been so supportive for all our webinars, for all our initiatives, for all the conferences and the webinars that we do during the span of the year. Dr. Barun Naik sir is here with us. Dr. Lalit Verma, Dr. Harbansh Lal sir is going to be here with us any moment. Dr. Mahipal is a very great support for us. Dr. Namrata is here. Thank you very much, Dr. Namrata. Rajesh is going to be here. Santosh is going to be here. Dr. Arup Chakravarti, unfortunately, and Dr. Chitra could not be here at this important webinar that we have today. I'm extremely grateful to the members of my scientific committee, Dr. Amit Porwal, Dr. Fairuz, Dr. Jatinder Singh Bhalla, Dr. Krishna Prasad Kudlu, Dr. Parikshit Gopte, Dr. Somshila, and Dr. Sonu Goel, for being the backbone of all our initiatives and everything that we do, right from all the webinars to the scientific program at the AIOC, is totally dependent on these great men and women. I have great pleasure in inviting Dr. Barun Naik sir as chairperson today. He is President AIOS and Head of Department of Ophthalmology at the Hinduja Hospital in Mumbai. Thank you very much, sir, for being with us. And it is a pleasure because you've been a very important person, not only as our president, but also you have had 6 years of editor as IGO, and you have seen abstracts coming for publication, and you do know the quality of a good abstract and how to segregate it from a not so good abstract. We have Dr. Surinder Pandav sir, chairperson, professor of advanced Eye Center and Postgraduate Institute of Medical Education and Research in Chandigarh. Thank you very much, sir. You train so many of our young postgraduates and you inspire them for publications and for their presentations. You would be in a position to tell us what is the importance of a good abstract. Dr. Harbansh Lal sir is going to be here with us as chairperson. He's vice president of AIOS, director of Delhi Eye Center, co-chairman of the Department of Ophthalmology, Gangaram Hospital. And we will have him and get his inputs on the various topics. Professor Namrata Sharma, Secretary of AIOS and Professor of Ophthalmology, Cataract, Cornea and Refractive Services at RP Center, AIMS in New Delhi. And under Dr. Namrata, hundreds of postgraduates get trained and they go on to publication. She herself has a large number of publications in peer-reviewed journal. Thank you, Dr. Namrata, for being with us. Rajesh Sinha, and again, the treasurer of AIOS, Professor of Ophthalmology of Cataract, Cornea and Refractive Services at AIMS, New Delhi. Rajesh, again, is a person who has a huge number of publications and knows how to get an abstract submitted as well as accepted, and not only in the conferences, but in the different peer-reviewed journals. Dr. Santosh Honawar, he's editor, Journal of AIOS and Director, Medical Services in the Center for Sight Group of Eye Hospitals and Director in the Department of Oculoplasty and Oncology at Center for Sight in Hyderabad. Santosh is going to give us great inputs about the abstract submission as well as the acceptance. And before we ask our first speaker to come in, I would request Dr. Barun Naik sir to give us a few words of welcome to our audience here today.
Thank you, Dr. Partha, for inviting me. And this is really important topic which is being discussed here today, because then I always feel that abstract is very important part, as just now Partha said, that abstract, because only on your basis of abstract, the selection or rejection decision is taken. But unfortunately, this kind of training is not given much and not publicized. Hence, this is very important. So without any further delay, I will request that to start the proceedings, Partha.
Thank you very much, sir. So I would request Dr. Rishi Swarup as our first speaker to tell us something about sustained hydration, hydrate to heal. And this is a sponsored talk, and we have the Alcon supporting us, this very important program. Thanks to Alcon, we have this program here today. And Rishi is going to tell us about sustained hydration and the insights about this new molecule that has come up. Dr. Rishi, please.
Am I audible?
Yes, Rishi.
Yeah. Thank you, Dr. Partha. And I'd like to thank the AIOS Scientific Committee and Alcon for giving me this opportunity. I'm very happy to talk on this particular topic because it's connected to something which all of us deal with in our clinics, which is essentially dry eye. And most of our post-operative unhappy patients are also, if we think about it, the source of unhappiness is often the dryness. And this new drop, which has been launched by Alcon, is, I think, a fabulous answer to many of these patients. And I'll just spend the next 10 minutes trying to make a case for these. I'd like to state that this slide deck is prepared by Alcon, and I'll be presenting it to you on their behalf. So dry eye is common. We all know it. Everybody who's seeing patients in the clinic knows that we are dealing with dry eye patients. And especially after cataract surgery, post-operative dry eye is a very, very big problem. And I'm sure all of us acknowledge that. If you look at this slide, you'll notice that especially when you're dealing with older patients after cataract surgery, as the age increases, the prevalence of dryness after cataract surgery significantly goes up. And this is, of course, attributable to many factors, especially age-related dryness is already there in this subpopulation, and they are prone to developing post-cataract dryness immediately after surgery, which can persist for quite a long time. But it's not just the older population, it's also the younger people who are having refractive surgeries. We know one of the main problems after refractive surgery is dry eye. And again, that is attributable to a number of factors, which I shall be coming to in my subsequent slides. Up to 95% of patients having corneal refractive surgery can have some element of dryness. And studies have shown that it can take up to 3 months for this dryness to go away, especially after cataract surgery, and after refractive surgery, it could be even longer. So by and large, it's at about 1 month, almost 60% will still have some element of dryness. And immediately after surgery, almost all patients have some symptoms or signs related to dryness. So why do we get dryness after LASIK and cataract surgery? What are the factors? It's essentially a combination of these 4 factors. A desiccation, which is basically lack of tears, damage to the surface epithelium essentially, a reduced tear film breakup time, which basically allows for the tears to again, the tear film to be destabilized. And of course, there's mechanical friction. And it's a combination of all these factors, and also probably an element of surface inflammation, which leads to postoperative dryness in most of these situations. Also, in post-LASIK, I think there's also an element of neurological loss also, which is playing a factor, which again leads to one of these, and we'll touch upon that in the subsequent slides. So let's touch upon all these 4 factors one by one. Desiccation. In LASIK, we know that there are multiple things, multiple factors which have been implicated. One is that you're making a microkeratome or a femtosecond cut, and you're disrupting the subepithelial plexus of nerves. And that in turn will lead to reduced corneal sensitivity. And because you're having that feedback loop getting affected, you'll blink less. And also the nerve supply to the meibomian glands may be affected. And both of these can result in an increased tear evaporation, resulting in an evaporative dry eye. Goblet cells can get damaged, especially when you're doing a microkeratome or you're applying the suction of your femtosecond laser, and that can damage the goblet cells, can result in reduced mucin production. And mucin has a very, very important role in tear film stability and lubrication. That again can result in dry eye. And because you're flattening the cornea, you're altering the shape and distribution of tears, and that can result by itself in reduced stability of the tear film, and that can result in dry spots, and that again contributes to dry eye. So all these factors are important in post-corneal refractive surgery dry eye. So what happens is you have a reduction of the tear film breakup time, but also there's a reduction in Schirmer's values immediately after surgery, and increase in the tear osmolarity. We all know that in the pathogenesis of dry eye, it's all these factors come into play. And post-refractive surgery, it can take up to 6 months for this dryness to go away. And it's important that when we are counseling our patients for refractive surgery, we must warn them about dryness, because this does happen in a lot of them, and it can take a few months for their eyes to come back to normal. Cataract surgery, what happens? This was about LASIK. What happens in cataract surgery? The intervention is essentially you're creating an incision. So again, you're cutting the cornea, you're damaging corneal nerves, you're creating a break in the surface. And both of these actions can also trigger inflammatory pathways. And all these things can contribute to your dryness. You can have disruption in the tear film stability because of the irregularities created and the inflammation in the tears, inflammatory markers which are reduced, which are liberated into the tears. And the nerve damage itself can cause reduced corneal sensations, disruption in the lacrimal loop, and that can again result in reduced tear production. So that's about desiccation, epithelial damage. We do know that the epithelial staining does go up after LASIK, and that can sometimes last up to 6 months or even 12 months. Why does it happen? It can be because of, in cataract surgery, it can be because of impaired epithelial wound healing, increased epithelial permeability, decreased epithelial metabolic activity, and loss of the cytoskeletal structures in the epithelial cells. Studies have shown that the location of the wound and the size of the wound both can play a role, and this could possibly be related to the points of entry of the corneal nerves at the limbus, and also your depth of the wound, the configuration of the wound, how, whether it's a single planar or a biplanar, all of these factors could play a role in the postoperative dry eye. Studies have shown that the epithelial thickness immediately after surgery can increase, and then it slowly reduces over the next few days. Even the corneal stromal thickness also increases and then comes back to baseline over the next couple of weeks. So I feel that this could be more to do with the endothelium rather than the epithelium, but it does affect the epithelium. And because of that, you can have the surface getting affected, the tear surfacing could get affected because of that. There could be irregularities which can again manifest as dryness. We all know that tear film breakup does reduce after any surgical intervention in the eye. And my personal take on this is that it could be because of two factors. One is the inflammation from the surgery itself and the drops that we are using. A lot of the drops contain preservatives, and we're doing a lot of frequent dosing, and that can affect the meibomian secretion and could also end up blocking the meibomian orifice. And that probably is one of the reasons why we have tear film breakup time going down. Again, we know that the nerves getting cut can also reduce the blink rate, and all of those factors come into play. Damage to goblet cells, we discussed these factors earlier. So this is just to show that the tear film does go down significantly after LASIK, and the good news is that it does recover. Schirmer's also gets affected, and this is a study which showed that at 1 week there was a drop in different age groups, and you can see the drop is more in the older age groups. But the good news is by 3 months, most of these do come back to baseline. So it's important that we do recognize that it's not just that there's an element of evaporative, there's also an aqueous component getting reduced, and both of these can contribute to postoperative dry eye. Finally, coming to the one that really causes the most pain, friction. And essentially friction is because you have a reduction in the goblet cell density and reduction in your mucin. And mucin is an important part of the tear film, which not just stabilizes the tear film, but also gives a lot of lubrication. And the fact that it is not there is certainly going to cause a lot of friction, mechanical friction, which will incite the inflammatory process and triggers that inflammatory cascade, which perpetuates the postoperative dry eye. So the impact of dry eye, yes, dryness is there, but if it's not causing an impact, it's perfectly fine. But I'm sure all of us have seen these patients who are absolutely doing beautiful after surgery. The vision is 6/6, whether you've done a cataract or a LASIK. Even the cornea appears to be glistening, but chub raha hai. They're telling you that they're uncomfortable, they're complaining of watering, and they have a foreign body sensation. And those are the patients who really distress us, because you've done a beautiful surgery. They should be happy, but they are not happy. And it really impacts not just the quality of their eye, but also the quality of their life. And it's certainly an unhappy outcome for both the patient and the doctor. And it's because of all these factors. So, and this has been quantified by various questionnaires, the OSDI, VF14, SHAI, and there is no doubting that the scores definitely get affected, and there is a genuine problem of post operative dry eye, which does need to be addressed. And I think this is where this particular solution offered by Alcon comes into play, which is the sustained hydration. And they have proposed this concept of HEAL, which is hydration, epithelial regeneration, augmented protection, and lubrication. And essentially they're impacting these 4 factors which lead to postoperative dry eye. So desiccation is tackled by hydrating, epithelial damage by promoting epithelial regeneration, the shortened tear film breakup time and tear film instability by augmented protection, and the final concept of friction is being impacted by lubrication. So what is it that sustained hydration has, which is unique? It's a combination of HP guar, sodium hyaluronate, boric acid, and the polyethylene glycol, which was already there in their Sustained Ultra. So the real addition is the sodium hyaluronate, which along with the polyethylene glycol, which is already there, is certainly improving the formulation significantly. We all know sodium hyaluronate has this coil-like structure, which increases its shear thinning property, and it attaches to damaged corneal epithelium, which basically increases its retention on the ocular surface. It's a natural occurring hydrophilic polymer. And HP guar has already been there with the Sustained Ultra family. And we know that it's a viscous gelling agent which binds to the corneal microvilli, and it acts like what mucin does to the eye. It's a mucomimetic, and it stabilizes the tear film in many ways, and it increases the retention time of the lubricant on the eye by itself. So these 2 are the main key elements which have been added and which really add a lot of value to this particular formulation of sustained hydration. We know that sodium hyaluronate binds to the ocular surface and traps 1,000 times its weight of water. So it significantly adds a lot more water to the surface, and that is how it hydrates the surface, the first concept of hydration. And mucomimetic reduces the friction. So this unique combination of HEAL is what really heals the postoperative dryness that we encounter, and which is such a bugbear for all our patients. So how does it hydrate? It traps 1,000 times its weight in water, thus providing a lot more water to the surface. And that's the real aqueous component is replenished in this particular way. And HP guar retains that water on the surface also, and that again helps a lot. And studies have shown that hydration protection against desiccation before and after treatment makes a huge difference. Epithelial regeneration, sodium hyaluronate, several studies have shown that it aids epithelial regeneration, and epithelialization time is enhanced with sodium hyaluronate. And so as a molecule, it's probably one of the superior molecules, and that is why most of us have now shifted to sodium hyaluronate. And this wonderful combination with polyethylene glycol, I think, is working really well. And that's the unique selling proposition in sustained hydration. It gives a wonderful combination which aids the epithelial regeneration very beautifully. And the time to epithelialization is significantly improved, as has been shown in several studies. Augmented protection is essentially they are enhancing the tear film stability because of essentially the HP guar, which acts like a mucomimetic. So it increases the tear film stability and increases the breakup time. And because the breakup time is increased, the tears stay on the ocular surface for longer. And essentially, your evaporative dry eye component is tackled by that particular way. And this has been amply documented by several studies, including this one. HP guar, I think enough has been said in the past as well. It has viscoelastic properties and shear thinning properties of sodium hyaluronate along with HP-Goa, I think both provide augmented protection to the tear film, which significantly enhances its stability much more than what we were getting with Systane Ultra. And this has been shown very nicely. You can see the curve showing post-treatment significantly improving with this particular combination. So to conclude, dry eye is a problem after both LASIK and cataract surgery, which are essentially the most common surgeries that we do. And it does impact the patient satisfaction. We all know that. And this combination of ingredients which is present in Systane hydration helps to hydrate, helps to regenerate the epithelium, augment protection to the tear film, improving its stability, and lubricate the eye, thereby reducing friction. I think it's a good molecule that Alcon has brought to the Indian market, and they have priced it almost similarly to their previous molecule of Systane Ultra. And I personally have used it in my own eyes, and a lot of my patients, I've moved them over to Systane hydration, and I can see that the patients are loving it, and they're happy that it has come to the Indian market. And I hope in the future iterations, they are even able to come with the preservative-free formulation, which will increase the value much further. Thank you.
Thank you very much, Rishi. And we'll have short comments from Dr. Namrata about Systane hydration, and then we'll move over to our presentations for the day.
Thank you, Dr. Partha. I think it was a very nice presentation, Rishi. And with all the presentations and all the studies, there's a lot of meta-analysis also, which have been published, evaluating the role of sodium hyaluronate in case of dry eye. And there are two, in fact, which contradict each other. One of them says that sodium hyaluronate doesn't have any effect. There are about 18 studies in that, and the other says that it has effect. I think what we need to break down is we need to see whether it has effect in dry eye or not, post-cataract surgery dry eye, which is going to be a different category, post-LASIK dry eye, which is going to be yet another category, and dry eye due to systemic diseases, which is again going to be yet another category. So I don't think it has been studied that extensively in details. We don't seem to find any publication or any randomized study of this combination of both, HP-Coar and sodium hyaluronic acid, although isolated, both of them are available. So it remains to be seen how it is, but I'm sure it promises to be a great drug. And let's hope that in future we are able to ascertain in which conditions it is going to benefit. Having said this, in the patients that we have prescribed, it causes it's thicker, it's more viscous than the Systane Ultra that we had or other lubricants. So it kind of it's not that liquid. So that is one flip side of it. But of course, in severe dry eye patients, it is going to help. I think for every publication that is there, one thing is very important that you have to look at, and that is if there is any conflict of interest or financial interest or not, because that will, skew the conclusion towards it or, away from it. But I think we do need to do long-term studies and in various indications, very nicely highlighted and presented, Rishi, like always.
Thank you. I'd like to add that even though it's viscous, it doesn't really cause blurring of vision. So it kind of does the job without the adverse effects of its viscosity. So the Systane gel drop, which is also there, it does cause some blurring for a few moments. But this one, I found that it actually feels very nice in the eye, and patients seem to have loved it when I've moved them over from older formulations.
So it's a difficult proposition. The companies will say, now we've come with Systane hydration. Now, what do you do with Systane Ultra, that the patients that you have been given, or what do you do with Systane gel that you have been given? Likewise, it's very difficult to shift a patient from one drug to the same drug of the same company. It's not an easy task. So how do you tell them, now you stop this and now you start buying this? So it's like that.
Thank you very much, Namrata. And So we come to our presenters, and we'll change the order a little and go over to Dr. Manisha Acharya. Dr. Somshila, can you please introduce? Somshila?
Yes, good evening, everyone. Thank you very much, Dr. Partha. And to kickstart this really wonderful meeting that we have today on how to present a good abstract, we have none other than Dr. Manisha Acharya. Dr. Acharya is a consultant and the Konya as well as medical director of the Eye Bank at Shroff Charity Eye Hospital, Delhi. She's a cornea specialist of many years in training, and she has presented at various meetings, both national and international. And her research work predominantly revolves around infectious keratitis and eye banking, which is a niche area. So she has a really, I would say, rocking presentation where she's going to take you through how to make a good abstract of an offbeat or a not a mainstream kind of a subject. So over to you, Manisha, looking forward.
Thank you, Dr. Somshila, for giving me this opportunity to present my thoughts on how we can present a good abstract. And at the outset, I would like to congratulate the Scientific Committee of AIOS for arranging this webinar. I mean, it's a very pertinent topic, and we're not taught, as was said, about abstracts and how to write them. So I would start my talk by it's like how to put an abstract of an abstract topic, something like eye banking. It's not very clear cut. It's easier sometimes, I feel, to put clinical abstracts because that remains our forte, and how to convince the reader that, okay, this also has a substance. So the first thing I would say is that an abstract is a self-contained summary. The purpose is to help the scientific committee decide whether or not to select this academic paper for presentation. It's the trailer of a movie which you will be presenting on that day, and a preview of the bigger document. Later on, when you look back, it is very useful for indexing also, and is important for a search engine optimization. So this was one of the abstracts which was sent for the Eye Bank Association of America meeting in 2019, and with the topic of impact of quality indicators and quality assurance and utilization of corneal tissues in a community eye bank. So I'll take you to certain steps what led us to this topic to come to this level where it was accepted, and we went ahead and made the presentation at the Eye Bank Association of India. Even we considered it, even if we could not physically be there. So when we come to the title of the abstract, it gets the scientific committee of the conference interested, what you really want to present. So the title should be descriptive, direct, appropriate, interesting, concise, precise, unique, and it should not be misleading. That's very important. You are writing something in the abstract and you're going on something else in the conclusion that usually doesn't match. It's like a mismatch. So I always feel a direct and appropriate and a non-misleading title is the best, which you should try to put towards the scientific committee of any conference. The objective should be simple, specific, unbiased, honest, concise, and precise. Again, that should not be misrepresentative. You're thinking of something big and you're not able to achieve. So here we put in the purpose as to study the impact of quality indicators and quality assurance measures for utilization of corneal tissues in a community eye bank. Then comes a difficult part. That's something, the longest subsection, which wherein you need to concise what all you will be doing, what all you did for this study to come up, or what you want to present. So it has to state what was done, and the duration is very, very important. What are the main categories you would be dividing it into, and main outcome measures, the parameters evaluated, and how the outcomes were assessed or analyzed. Like something like what were the statistics used in the particular study. So for this, we put in the period of the study, which was 2008 to 2010, the categories in which it was divided, and what was the procedure which was followed very concisely, and also the period wherein we did a pre-intervention or a post-intervention study, whatever we had to do. The results, again, are very, very important, and it states what was found, what needs to be mentioned, and the numbers are important in the results. Sometimes we feel that you can send an abstract even when your study or your analysis is not complete. That's not right. You have to have the numbers in your result. So you have to tell them how, what is the pre-intervention number, what happened post-intervention, and how did the non-utilization, or what were the other parameters or the salient features which came out as results in the study which you want to present. Then comes the last but not the least, the conclusion. So again, that's actually the take-home message which you want the conference. It should be very apt and pertinent to the conference where you're applying for. Like if it's an ARVO conference, it has to be written a little differently because the research is the main aim there. If it's an academic conference or other conference, something like an iBanking, it has to have a more holistic or a bigger view. Something like what can be extrapolated to most of the iBanks in this case, which we could say. That we said that this stringent implementation of these would effectively increase the utilization rate, and it can be effectively adopted because it's an objective way how you can put them in your iBanks. So the interpretation of the research question and the results put together should come in the conclusion, and the author's view on the implications of the study are also acceptable. Here you can put a line or so of what you think after the study would help the rest of the community. So when you have an abstract like this, it's very nice and heartening to see that it's presented in these bigger conferences and you're able to present. And unfortunately, I couldn't go, and they asked me if somebody else could present it on our behalf. So, I mean, it was more like a video, or if somebody else could also present over there. And our iBank partners, Miracles Insight, we had people there, and there this study was presented by Mr. Mike Tramble. So, and if you have a good abstract and a good study coming up, it usually always leads to a publication. And that also, that's sometimes you feel is the end result which you want to give for a good study which you've conducted. I would say sometimes an idea is important, and this idea actually came to me when we got this award on the Quality Improvement Team of the Year. At that point, it was like an abstract thing which we had put, that how quality can improve iBanking. And to put it into a paper or a study is not easy because it's a very abstract thing. So we had to think again, and we went through and did a lot of research on what we can do on this topic as well. So, I mean, I got this very nice checklist from this very nice article, which gives us all the useful tips for formulating a good abstract for a research question. So if we keep most of these things in mind, and the abstract can be simple, it can be concise to the point, and it can have the right amount of word limits, and the right message goes to the scientific community. Thank you again, AIOS, for giving me this opportunity to present in this very august forum. Thank you so much.
Thank you very much, Dr. Manisha. And I'll request Dr. Barun Naik sir and Dr. Somshila to discuss what Dr. Manisha presented.
Dr. Barun Naik is logged in.
Yes, sir. He's there. Yes, sir.
Yeah. Can I comment?
Yes, please, sir.
Yeah. Yes, it's very nicely presented just now by Dr. Manisha. And some of the things that she highlighted, that it has to be, because there is always a word limitation for the abstract. So in that word count, you have to fit in whatever you have to communicate. But as you know, this is not the entire article. So you cannot communicate everything that you have done, every result that you have got. So mainly, whatever is the most important aspect. So that part in the title will tell everything about whatever is the paper about. But in the abstract, whatever the fitting to the title, it has to go according to the in method section, that whatever was done, that again it will be means it should be as complete as possible in that limited word count. And result section, you cannot give everything as you give in your full text article. So there you have to choose what is the most important aspect. and that part you have to provide over there. And it should be, whenever you come to a conclusion should be based on, just remember this, whatever data you have presented in your abstract, not whatever you have got in your entire article, because that in abstract you are not writing. So whatever you are presenting your data in the abstract section, only on the basis of whatever conclusion you can draw, you should draw. And conclusion, usually what I have seen, that many people just simply write something and then conclusion is just, it's a vague and generalized, which is just not possible to conclude from that basis. Because one very a good example which always I quote, that sometimes people, whatever you say, suppose they are comparing two things, and one they found it to be superior, or two mode of treatment, or two medication, one medication superior to the other, and the medicine which is found to be superior happens to be cheaper medicine, it doesn't mean that you can conclude that this treatment is cost effective, because it is efficacy you have proved, it's superior, but cost effectiveness is a separate study altogether. So that type of generalization should not be done. And plus also, whatever the population that you have studied, so whichever population, only that population the study will be applicable to, or the conclusion will be applicable to. So that also, if it is possible to mention, if you have written in the material method about the population part, then that also you should mention. And last point I just want to say, that some people get confused that whatever is your planning, that planning should come in the material and method. And whatever you have got your findings, that will come in results section. Just to explain that sometimes people, they simply write, we studied in material and method section, we did a retrospective analysis of 100 case files. This is not the correct way of writing, because 100 case files, how this will come in this. Here you will say what was your plan, that how did you select cases, those things you can write, what time period, that as she said, that the time period that she had very nicely mentioned in material and method. So that time frame will come, and then you can, if space is there, which is probably not there in abstract section, so then you can write why, because you chose this time period, because on the basis of this you wanted to study so much, so at least you guess that this you will get this much number. Ultimately what you got will come in result section, will not come in material and method. So I think anyway, there are a lot of other also will be discussing on various abstract, and also I would like to hear from Shomsila on this.
Thank you very much, sir. I think very, very pertinent points. To discuss what I have additionally on that is, well, Manisha has picked up pretty much every section of the abstract. So one important message is that I think that, well, it's very difficult to satisfy this, but the idea of sending an abstract is not that you want to attend the meeting and you want to get clearance from maybe the authorities, or maybe your professors, or maybe in an institute set up from your management, and so on. So the idea should be that you have something that you're working on and you want to present that as a research paper, and then eventually you want to publish it, because if you don't publish, then it's not yours. It's like that. So related to that, it's good if you have a robust or some kind of good study that you're doing, maybe especially for the residents. I think all the DNB theses would eventually make very good papers if they're working on it very well. So that could be definitely the start of a good abstract or a good presentation for them. So that is one aspect, that the idea of sending an abstract is not just to attend a meeting, but actually to present your work, which you want to publish later on. So if that's your attitude, then you'll definitely have enough material to make a good abstract. So a few points about title. Sometimes I think maybe because of social media influence or whatever, all the messaging that goes around, I think the general idea is to have a very catchy title, or something with some words or some buzz, or use words like devastating or conundrum, or all these words. So these are not necessary. It can be simple. And as Manisha mentioned, that it should be fairly descriptive and accurate. So if in my study, I'm going to look at the outcomes of graft rejection in the case of DMEC, that is going to be my title. I'm not going to say something very different from what I'm doing in the article. So the reviewer will clearly know what they're looking at. And so depending on the meeting, for example, if it's academy, you have only 100 words or 150 words. And it's very difficult to get your abstract filled in with all the with what you want. So there you have to compromise in the sense that typically materials and methods, you might shorten it. But results, I think, is the body of your abstract. So results should be very complete and also include statistical methods. There have been several abstracts that have come which have said that results will be presented at the meeting. So that cannot be in the abstract. So the results have to be there. Sometimes the results are done with very basic what you can do, office-based Excel, just the demographic details and some percentages, but it's a fairly large study. So you have to put in statistical tests that has to go into your results. So without that, it doesn't make a good abstract. And same points as Dr. Sir said about the conclusion. Dr. Baranak mentioned that it can't be just some off-the-cuff conclusion. It has to be related to what you have published in the study. We can't make grand reaching conclusions based on our research. So we cannot extrapolate beyond our data.
So can I just make one comment?
Yes, please. Yes.
So Manisha very well presented, but like you said that we could probably put our view in the abstract. I think that will not be a correct thing to do. You just have to put in your conclusion, you just have to put what is the conclusion of your study. That's it. And like Somshila said, in American Academy, it's very difficult. You have to finish everything in 100 characters. So it takes 2 hours to do an abstract, which you've already actually written in some, 300 words or 250 words. To get it to 200 characters, you take 2 hours, to decrease the characters. And of course, the p-values, the statistical analysis, those make a lot of difference if you already have in the results. And always mention it's a retrospective study, it's a prospective study, it is a randomized controlled trial, because that will help you, to get your abstract in. Because if it is a prospective study, or if it is a RCT, or if it is, that adds value to the study. So I think those are, otherwise you covered everything.
Thank you very much, Dr. Amrita. We shall go over to our next presenter, and that is Dr. Amar Pujari. And I would request Dr. Prashad Kudlu to introduce, please.
Thank you, Partha sir. Once again, it was a fantastic session. I think we all designed so that people, I think those who are hearing this, I think they should, next time onwards, those who are making a lot of mistakes, come up with a proper abstract submission. To tell us, I think, about the abstract submission in cataract format, I think we have got Dr. Amar Pujari, who is the assistant professor in prestigious RP Center for Ophthalmic Science, All India Institute of Medical Science, New Delhi. Over to you, Dr. Amar.
So if I may just add, Partha, Amar has more than 125 publications already in the international peer-reviewed journals.
Oh,
all of them in excellent journals, Survey of Ophthalmology, AGO, Ophthalmology, Archives, you name it, and he has it. So we are all really proud of him.
Superstar of our today's presentation, madam.
Thank you, ma'am. Thank you, sir.
Congratulations.
Respected seniors, so I would like to present my topic. So I was set to choose a topic based on my previous publication. So whenever you want to prepare an abstract, you need to understand whether it's for a conference or it's for a publication. Because conferences, often they are going to have 1,000 characters, including spaces, which we can find at the bottom of the Word document. So for publications, the word limit will be up to 250 or even 350 words, depending on the journal you are selecting. And in gross, if you are submitting an abstract for a conference, it's going to have 4 components: purpose, methods, results, and conclusion. There you won't disclose your setting or your hospital, this thing. But in publication, there are certain privileges where you can mention what type of study you are doing, RCT, retrospective, prospective, and even you can mention the set of where you have done. So reading the author instruction is very important, so that you can just avoid bothering emails to the societies or the journal these things. So why abstract is necessary? basically it is a kind of status. Whatever the status we are going to put on our Facebook or WhatsApp, it's going to be a status of that particular paper. So which speaks for itself. If you're like just reading the abstract, you are going to unveil the entire 3 years over movie. It's going to be a trailer kind of thing. So in abstract, you need to introduce what is unclear in the literature. So you need to read the literature. You need to understand, yes, this is the literature, what I have said, but this is a new thing I am finding. So this is my pilot observation, which based on this idea, I want to explore more. So, okay, I found this one. So I want to put it in abstract. Then I want to make it as a full length article. So you need to be sure what is unclear in the literature. You need to be stating that in very clearly and very briefly. So what is your basic research question? So if the literature has this much knowledge, so what is the extra thing I am going to say based on prior to that, you need to put a research question. So if you are able to find an answer for that research question, if you have found an answer, so what it is, so what it exactly says, and you can give future directions also, how that can be implemented for clinical purposes. If at all, if you don't find any results, the results are neutral or negative, you need to state that one as it is, and what next can be done. So if you are proving or if you are ruling out something, so it means that somebody has worked for almost 1 year or 2 years. So they are stating that this method or this thing cannot work. So we are going to, of course, even if you are presenting negative results, that has some significant implication in the literature. So basically, as I said, it has 4 structures, right? So first one is purpose. So in purpose, we must state the research question, and it should be very brief and clear. It should be probably 1 or 2 liner. That's it. You should not give whole of introduction here, because we have a dearth of word limitations. So it's going to be a first impression. So whenever somebody reads a purpose, okay, this guy is doing this study. So it is his basic idea. Let's see what he is trying to do. Okay, it introduces your motives. So okay, when reader want to read the full text, okay, this guy is having this purpose. So let's see how he has done the methodology, results, and conclusion. So based on that one, I can decide whether I should read a full text or not. So here I have a purpose where I am mentioning clearly to systematically observe and analyze the signs of deficient capsule in post-polar cataract. That's it. How I am doing, how many cases I am doing, I am not going to mention here. It's going to be only observation of post-polar cataract with deficient posterior capsule. 3 keywords. In methods, I'm going to comprehend my strategy. So whenever somebody is going to read your strategy, they are going to first of all question whether he has done legitimate methodology or not, whether I or rest of the people in the entire world, they can replicate this simple methodology or not. If they find something suspicious, yes, this methodology looks suspicious, so everyone cannot replicate this one. So that's why we have to focus. Ultimately, we are doing studies just for our colleagues only, our patients only. So ultimately, we need to convey it clearly to our colleagues and patients. Okay, this is the methodology we followed, and this is the thing which we found. So then you are able to analyze, yes, okay, this guy is saying this is the methodology, how he has executed that one, whether it's appropriate or not. Is there any lacunae or loopholes in that methodology? They are going to critically analyze that one. So here, again, in methods, I'm going to say the post-polar cataracts, the keyword, the AIOS I'm going to image, and I'm going to find out the post-capsular integrity. Okay, so you can mention the numbers in methods also. So in results, you are going to say what did you find exactly, right? So it is going to be again briefly and clearly. And whenever there are values that are significant, you need to mention that one. So many people have said that one. So in mainly results, you need to mention the age group, as Partha sir was saying. So age group is very important, pediatric, adult, or older age group. So demography, including ratio, sex ratio, or other factors you can mention. Numerical values you can mention, p-values and statistical significance must be mentioned. But here you need to understand, yes, this you can see the result section of my paper where I am said that I analyzed 101 eyes of post-polar cataract. So the mean age was this much with standard deviation. And in this one, I was able to find intact capsule in 91 eyes and deficient in 9 eyes. And again, in the deficient capsule, I was able to categorize into 3 patterns. One is conical sign, second one is Moore-Thurton pattern, third one is ectatic pattern. Again, I'm going to mention what is the number of eyes out of 100 eyes which I found. So you can mention percentage values also. I didn't mention because the word limit was crossing. So in the same way, whatever the thing I found, what was the intraoperative correlation, and ultimately, what is the correlation between the AIOS finding and the intraoperative judgment. So conclusion, you are going to unveil the answer, whatever the research question you had. Okay, this is the methodology I followed, and this is the research results I got, and this is a conclusion, one conclusion or a simple conclusion I want to project it to the literature. So it also states the expected future also. But basically in post-polar cataract, what I said is the deficient capsule can be identified on ASOT and it can be categorized into specific as well as generalized morphology. In specific, I can categorize into conical, Moore-Thurton, and ectatic patterns. In generalized, again, I'm going to divide into 2 patterns. So this is another example of an abstract. So every journal is now having a metrics pattern, so where you can find out how many people have read your articles, right? So here you can see in last year, 167 people have viewed my abstract along different regions of the world, and 47 people have tried for full text, and 9 people have downloaded it. But ultimately, open access of the journal and other factors, subscription, all they are going to matter for your full text. But if enough people are reading your abstract, that means that you have done a good job. So that's what you should focus. Thank you.
Thank you very much, Dr. Amar. And I would request Dr. Harbansh Lal sir and Dr. Krishna Prasad Kudlu to discuss, please.
Sir, Harbansh Lal sir, unmute, sir, unmute.
I think it's an excellent presentation, Amar Pujari. I think it will give a lot of insight to the people who are watching this, how to prepare the abstract. And this is very, very useful. I mean, if you want to publish some study, you should have a purpose of doing it. So there is no point of keep on repeating what has been already said. So you will have to find out how finer that point may be, but there should be some direction. I think that is very well highlighted, and I don't have to add anything further.
Yes, sir. Very nice presentation, Amar. But what I liked about, I think those who are hearing for the first time, beginners, especially PGs or even junior consultant, if they really follow what you said, purpose, methods, results, and conclusion. These are the 4 points. I think you had clearly said about the take-home message. As Namrata madam said, that probably that is the success behind your story, more than 150 publication in most of the journal. I think I need not have to say anything extra about you had given, I think, so much basic idea about how exactly you have to go ahead with the presentation, abstract for presentation. I think if you follow your each word, I think any of us, those are even seniors also, definitely refine our abstract submission. I think any word, Partha sir, you can add.
Thank you.
Yeah, thank you very much, Amar. Actually, this is going to be a great insight for people who are going to be submitting abstracts for our AIOS, the scientific committee, and the AIOC that is upcoming, because we are already on to submissions. And believe me, it is the instruction course submitted in the previous years were nearly 600. In 2020 as well as 2021, 600 plus instruction courses were submitted, of which just about 150 to 160 instruction courses are actually accepted. So it's a very, very large number who submit and we are not able to accept. And that is what is the crux of all this. The free papers that were submitted in the previous years went up to 2,400, and we could only accept just about 344 free papers in the last year. So the competition is very high. It's very, very high. And what is the crux of the matter is the good abstract. So thank you very much, Amar. And I'm sure all of us are taking home great points for this. And next, I would request yes, and next I would request Dr. Nikhil to be introduced, please.
Yeah, thank you, Partha. I'm Dr. Amit Purwal, member scientific committee. Thank you, the whole team. I mean, we have come up with such a great webinar on good abstract and bad abstract, which is going to help all our submitters, especially for these AIC conferences. So to introduce Dr. Nikhil Balakrishnan is a consultant at Sai-Deep Eye Clinic and Crystal Vision Research Center. And he did his fellowship from Narayan Nethralaya, Bangalore. And to add to his academic activities, he won the Best Scientific Paper Award at APCRS Congress in 2019 and the Best Video at the International Video Film Festival in 2020. He also won the prestigious D.V. Chandra Disha Award for the Best Paper in Glaucoma in the recently concluded AIC 2021. So Nikhil is a young, dynamic, ideal speaker to guide all the young submitters how to write an abstract properly. And as Somshila had rightly pointed out, a student can write an abstract in a proper way if he has done some real scientific work and he wants to showcase to the world, then he will be able to write a proper abstract. But if he wants to send an abstract to a conference so that he can get a conference leave and which is a part of his DNP curriculum or his PG curriculum, then whatever he writes, he just feels कि अगर select हो गया तो present कर देंगे, and that just creates increased burden and volume of submissions, and we the scientific committee have to bear all these poor abstracts. So in order to reduce this burden and to educate our colleagues, we have come up with this webinar. So Nikhil, over to you to brush everybody about how to write a good abstract.
Thank you, sir. Thank you, AIOS ARC, for giving me this opportunity to talk at this platform
It's
today.
AIOS Scientific Committee, Nikhil.
Sorry, AIOS.
Yeah, thank you.
Sorry for the mistake. So I'm going to be talking on good abstract, bad abstract. For any free paper presentation, the first step is to get the abstract selected. And like already discussed, the abstract is basically like a trailer for the movie. If the trailer isn't good enough, the movie, no one is interested in going ahead and seeing it. Similarly, if your abstract is not up to the mark, it's not going to get selected. And however good your study be, however good you've gone into the depths of it, you're not going to get a chance to present it. So how do you write a good abstract? This was the abstract I'd written for my paper, which won the best paper in the glaucoma session last year at AIOS 2021. Important thing first is it should have a good catchy title. It need not have a lot of fancy words, but it should clearly explain what your study is all about. One perfect line to explain what you want to get across to the audience. It has to be through the title. The aim of the study should be very clear. You should not beat around the bush. The exact thing that you want to get out to the audience. The most important part of the study, what is the real purpose of it, should be clearly mentioned in the purpose part. The most important thing is to write the abstract in good English. Make sure you've not made any grammatical errors or spelling mistakes in it, which puts off the reader and immediately causes him to disqualify your abstract. In the results, it's very important to mention all the statistical analysis, the actual numbers. The most important ones, as it's already been discussed here, that usually there's a word constraint or a character constraint in your abstracts. So the most important results should be mentioned in your result column with the actual numbers and the statistical analysis in that too. Conclusion is, again, it has to validate the purpose of the study. So therefore, if your study has asked a particular question, it's a question that you have put across, that what the whole study is about. The answer to it should be there in your conclusion. Only that concludes a good abstract. So as I explained, has already been discussed, that the abstract always should have titles. That means it should be very clearly mentioned the purpose, what are the methods, what are the results, and what are the conclusions. It's very important to get straight to the point, provide the most important information of your study in the abstract. Frame it from scratch. Don't copy paste bits and pieces from elsewhere, from previously written abstracts or from other papers which you are referencing. Do not use any references in an abstract. This has to be the real information, what your study is all about. Don't use lines or references from other previously done studies in your abstract. Just provide a broad overview. You cannot get into every small intricacy, every small detail in an abstract because you have a word constraint. And finally, revise it once again when you're finally done with it. Format it well, do a spell check, and avoid any kind of grammatical errors. Thank you.
Thank you very much, Nikhil. And to discuss, we have Professor Pandav and Dr. Amit Purwal.
So, Partha, before Pandav sir discusses the good point of what Nikhil has already presented, as we had discussed for this webinar, I shall present two bad abstracts. I will tell them what are the bad points, and then I think Pandav sir will be in a better position to tell what was right, what is bad, and how we should go ahead. So I'll just begin with my slide sharing. So as discussed, I'm just going to have two slides on basically what are bad abstracts. So I'm just showing you one abstract here as we ask for a synopsis. So every conference has their own strategies, the way they want the abstract to be written. So in this case, the synopsis is written and you can see the title itself. Okay, the title should have been in a sentence case, but here everything is in capital. So this is something, I mean, I'm talking about grammar mistakes. Then coming to all the things highlighted in green. Okay, see in the title, comparison of ribbon toponometer with GAT and its correlation with CCT. Now, what is GAT? What is CCT? So we have to mention the full forms when we are writing it. If it is a standard abbreviation, it is different. Coming to the green, everywhere in the abstract, only abbreviations are written. So that is not a good way of writing an abstract. You should mention always the full form. And if the word limit is there, then you can write the short form in the bracket so that it can be used further in the abstract. Then coming to the result. So the aim is to compare the IOP readings taken by RBT eye care with GAT and the correlation with CCT. This was the aim of the study. And what is the conclusion? RBT can be considered a reliable method of IOP measurement as compared to GAT across all ranges of CCT. Now, this is the conclusion. Whereas if you read the crux of this synopsis, when you look at the result, 400 eyes of 200 down-glaucomatous patients underwent IOP reading by RBT and GAT, and CCT was also noted. Patients with any ocular surface disorder or any posterior segment pathology and patients who were not willing were excluded. The IOP values were compared and were correlated with CCT. The mean IOP reading is mentioned, whereas there is no mention of CCT at all. So in the abstract, you have not mentioned any values of the CCT, but you are giving a conclusion. So this is one study. The other study, I am just showing another abstract of saying how it is a bad abstract. So if you see the indications and visual outcome in iris claw lens, in iris claw lens implantation in SICS, again, titles, capital, everywhere caps lock is used to mention the heading, wrong. Then mentioning the name of the institute is never done in any abstract. Most of the conferences and the publications, they don't want the center to be mentioned in the abstract. Coming to the result. When you look at the result, there are no statistics at all. So everything is just descriptive. There's no statistics. Conclusion is different than what was the aim. So what was the title given? Indication and visual outcome in iris claw lens implantation in SICS. And what is the conclusion? Alternative options like ACIOL and SFIOLs are associated with corneal decompensation and steep learning curve respectively. Iris claw lens still remains the cheap solution in posterior capsular rent in comparison to ACIOLs and SFIOLs. So you are writing one aim and your conclusion is different. So this should not be there. Then again, when you have word constraint, you are supposed to finish in 1000 characters. So now what a person does, I mean, I have been evaluating so many abstracts. I come across this, you can see the one highlighted in green. Because the character count was limited to 1000, there are no spaces left. So they have joined all the words. There is no spacing. So grammar has to be taken care. So all these things has to be taken care, and you have to write a proper abstract. You just can't just send and think that हमने तो abstract भेजा था. AIS doesn't accept our abstract at all, whereas it gets accepted in a state conference or in the conference or XYZ conference. No, everything which gets accepted has to have a quality. Without a quality, you can't think of that the abstract will get accepted. There are no influences, nothing is taken care. What speaks is the way you write and send to the scientific committee. So over to you, Pandav sir. This is just what I wanted to show. As discussed, we were supposed to present two bad abstracts so that the good and the bad part is highlighted. Otherwise, all the 6 presenters will be speaking the same points again and again.
Yeah, Pandav sir.
Yeah, thank you. I think that was good. So we have actually now seen both sides of the story. We have seen some excellent abstracts and excellent talks basically, and also how to go about creating a good abstract, something that gives you the snapshot of your work and convinces the people to read on further. I think most of the good things have already been said, and I think Amit has also shown you, some examples of abstracts which you can't really understand well, or you can't really draw conclusions which are drawn in that particular, in particular study, or they are not formatted correctly, or they're very difficult to follow through actually. So I think, but in an abstract, the most important question is, I think Dr. Pujari mentioned it, is the research question, is the purpose. So the research question should be very clear, and that should be it should be relevant also to the, something should be there in that research question which is relevant to the current needs of the medical research, the community basically, but at the end of the, whatever you do, it's for the patients, for the community. So there has to be something for them directly or indirectly in that research question. And the research question has to be relevant to the needs of our own needs, the needs of the nation, and very clearly specified. So it should not be too many. So if you have
Like sometimes you have a large study which has, one purpose, and then you have it, they have some secondary objectives are also. So one main objective and then many secondary objectives. So I think again, the focus should be on the main objective of the study. Many times when I read abstracts, a lot of time or space is actually spent on the introduction. So introduction has to be minimalistic, just one or two very relevant, the background sentences if they're required. And that's where you can save time and space when you are writing the abstracts. So once you have done a, good, when you framed your question, the research question, nicely in a properly, easily understandable terms, and writing a question, sometimes we may, we may write in a very scientific language, which is sometimes difficult to understand. I think we always try to, even though either the science, some technical person or scientific person is going to read it, but still it is better to make it in a way that is easily understandable, even by a lay person. Sometimes it will not be possible, but the effort should be to make it easily understandable. And sometimes the other difficulty sometimes you find is that the components, even if it's a properly structured abstract, the components may not be easy to follow through. So there has to be a followability. So you should be able to follow from one segment to the other segment to the other segment. So that flow should be there in an abstract. And it's already mentioned that, when you are writing the material methods, so stick to, the material methods only, don't put in results there. And when you're doing the results, so put the results there, that means something, which is important to the objective, and, some statistics or some, some way to decide that whatever is done or whatever is being projected is authentic. So that has, the sense of authenticity has to come into the results. And they should be, as I said, they should be one should be able to follow through, and also they should be connected, or they should be in sync with each other. Because sometimes the conclusion are drawn which may not be in sync with the research question itself, or the methodology, or the results which are projected. So many times that there could be a discrepancy between different parts of the abstracts. I think that has to be avoided. So what I would say is that have a good title which attracts attention. Then a research question has to be framed properly, and it should be easily understandable as well. And then the methods, results, and the conclusion, you should be able to follow them through, and they should be in sync with each other. So many times we find that the conclusion, particularly, they are not in sync with the methodology or with the results. And many times there's a kind of an extrapolation there, which has to be avoided. So I think that's all I had to say about this. Thank you very much.
Thank you, Pandav sir. Over to you, Partha.
Thank you very much, Pandav sir. We go over to our next presentation. And I would like to request Dr. Parikshit to introduce, please.
Good evening. We have Dr. Rishikesh Mai, a very young, dynamic ophthalmologist from Nagpur. He's an alumnus of Shankar Nethralaya, Chennai, and an ex-consultant at Center for Sight, New Delhi. He has presented his work at many national and international conferences. In fact, he's won the Best Podium Presentation Prize in Neuro-Ophthalmology in AIOC 2021. So over to you, Dr. Rishikesh, a rising star in Vidarbha Ophthalmology and Maharashtra Ophthalmology Society.
Thank you, sir. Parikshit, sir. I'll just share my screen. Okay, it's visible, right?
Yes, Dr. Rishikesh, we can see it. If you can just do slideshow.
Thank you, Partha sir, and thank you, the Scientific Committee of AIOS, for giving me an opportunity to share on an abstract topic about how a good abstract in pediatric ophthalmology should be. Many of the, I will just skip many of the things which have already been repeated by the speakers. Actually, many of them are from institutional practice. So for a private practitioner, to do a scientific study and to publish or even to present or create an abstract is actually a challenge at times. So I mean, what I usually followed was I kept on attending the free papers, and I will be presenting one of the free paper, which finally got accepted after multiple rejections for the earlier presentations which I did. So as one of my mentors had mentioned, every outpatient has something worth presentable and publishable. So you need to study what is unique about that particular case or for the group of patients which come to you. Choose your topic which you see something unusual in otherwise usual cases, and uniqueness of the study is very important, which I feel many of the times in pediatric ophthalmology or strabismus, we directly jump to topics related to vertical strabismus or complicated squints. But there are a lot of topics like simple refractive errors in children, or what is the effect of different type of dilating drops on patients, or effect of diluted atropine on myopia. These can also be included in the study and are worth publishable actually. Most important is go through the literature search and compare your study with the previous study which has been done, so that to find out what different you have got, and also be genuine. Don't try to manipulate the data to get a desired result. Sometimes no result also is a good result. As already mentioned by Manisha madam about the title should be crisp and simple. Avoid very long title, and you don't need to put flashy words like demystifying or something like that. It should be very simple and straight, so as to come to the point directly. The second part is the synopsis. The second part of the abstract which you will be submitting. Go through the I mean, for what you are presenting, because sometimes like in AIOS, we don't need to put in different titles like introduction, methods, results. You simply put in a single paragraph. But something like World Society for Pediatric Ophthalmology and Strabismus, WSQS, it has to be in these headings which you will be presenting, or which the abstract has to be submitted. So mention the nature of the study, prospective, retrospective, also the number of participants or the samples, and important result related to aim of the study needs to be mentioned there. And I mean, that has to be the highlight of whatever you are presenting. So as Dr. Amit had already mentioned, the aim and the important part of the result, they should be in sync. They should not be separate. And use simple, understandable words, avoid long sentences, and avoid unnecessary words, which will increase I mean, it has to be fit into the word limit, actually. So I'll just briefly mention one work which we had done, which got accepted at AIOS, was the treatment outcomes in childhood ocular myasthenia. A very simple, straightforward heading. I mean, it was in a paragraph, but I would like to put it like the first sentence has to be the introduction of the study which you are doing, which should also include perhaps followed by the aim of the study. The present study is a prospective analysis over 1 year aimed at evaluating the outcomes of medical treatment in childhood ocular myasthenia. It includes 8 patients, that is the number of patients, the prospective study over 1 year which presented to us with age group 6 to 15 years. So that is the method, especially the inclusion criteria has been included here. Then
Sir,
coming to the results, coming to the results which need to be mentioned, because it was a clinical study, I mean, related to medical treatment, we need to tell about what was the clinical features before, what the medical treatment caused, and what change did happen during the outcome, and also the follow-up period. Like in this patient, in this particular study, we had studied 8 patients. The first part includes the clinical features before the treatment, then the medical treatment which was initiated, pyridostigmine and steroids and things like that, and whether the patients were followed up regularly for 2 years, and then the parameters which were checked during the follow-up. Also, the clinical features which were seen during the follow-up has been mentioned here, and it should cover all the 8 patients which you have committed yourself to. And thus, we concluded the conclusion part, which is related to aim of the study, that the early medical treatment helps in remission, avoids recurrence, and the generalized myasthenia. So in this way, if you write, I think all the ideas or all whatever you want to present becomes crystal clear in the minimum words which are expected of you. Thank you.
Thank you very much, Rishikesh. And Parikshit, would you like to discuss, please?
Yes, can I just share a screen and show a single slide?
Yes, please.
Well, Dr. Rishikesh has explained it succinctly, and we've had a galaxy of speakers, all of them stalwarts in their own right, who have told us about their abstracts. So Dr. Amit, of course, gave a very good about how an abstract should not be. And in today's at many places, an abstract is just 100 or 150 words. In many places, it is just 1,000 characters. So sometimes it can be even less. So in that, it has to be succinct, it has to be informative. As Dr. Manisha put it, the aim has to be clear and concise. But then as Namrata ma'am said, if we put in things like prospective, if it is randomized controlled trial, if we tell exactly what it is, and in fact, for many veterans, what they look at is the methods part of the abstract, because that is the most important one. How was the study done? When was it done? Where was it done? By whom? By which manner? How long? How much was the follow-up, the loss to follow-up? That is more important than the result which says what was found out. And finally, as Nayak sir said, the conclusion, what does it mean? It should flow from the result. It should not be the other way. We are just concluding what we think is important. We must take a lot of time to write the abstract because, as the speaker said, it is perhaps the most read thing that is there. So it's like a trailer of the film, but the film trailer will show the hottest or the most controversial scenes. That's not with the abstract. It's like a review or a book review that we write. Well, and we also have here Dr. Santosh Honavar, who is the editor of the IGO and a veteran in this. So over to you, Honavar sir.
Santosh is joining in time, but if we can have Rajesh, would you like to make a comment on Rishikesh's presentation?
Yeah, sure. Actually, I was just listening to everyone, and it was a wonderful session. I mean, most of the things have been discussed. Rishikesh presented very well, and it was absolutely crisp and nice. A couple of things, I don't want to be repetitive. A couple of things I would just like to add that, what he was also trying to indicate that, in a structured abstract, it is very easy to, write that, okay, it's structured, like divided into objective, method, result, and conclusion. But certain times in unstructured abstracts, what happens that the sequence again should be like that only, but sometimes the sequence is not that. And while reviewing a few of the case series and a case report, I could figure out that that sequence is lost. So that one has to be careful. And one thing I would like to add, one more thing which probably has not been mentioned here is that many times we derive causal relationship from something which from a design of study which is not meant for causal relationship. Like suppose a case of presenile cataracts, if you have done a case series of presenile cataracts and you got something in the aqueous tap, some finding, some mediator, something like that. We cannot extrapolate and we cannot say that presenile cataract is caused by that, because for causal relationship, you need to do a randomized study. So these are a couple of things which I wanted to add, because many times in conclusion, there's a general habit that if we get something, suppose I get some mediator in the aqueous tap in all the presenile cataracts, or then I will say that this can cause presenile cataract. We cannot say that. So that is something which we have to understand, that what is the design of study and what conclusion we can derive from that.
Thank you very much, Rajesh. We go over to our next presenter. And Dr. Sonu Goel, are you there? Sonu was actually on the way.
Actually, Sonu is not here, and he has requested me to introduce Pooja, who is the phaco-refractive surgeon, a very young and dynamic surgeon, and very good student. She is currently working at the Vision Eye Center and the CKI Institute, and she has got her education from D.Y. Patil Medical College, Mumbai. And she has also done clinical research fellowship from Johns Hopkins University, Baltimore, USA, and Narayan Netralaya, Bangalore, India. So over to you, Pooja, who is bubbling with energy and very good in already showing interest in academics. Over to you.
Thank you so much. On the onset, I would like to welcome and I would like to thank the scientific panel committee for allowing me to have such a presentation at such an important topic and inspire those people who are trying to write a good abstract. So, as we all know, the main important things that are required is aims, methods, results, and conclusion. But we need to make sure that these make a first and lasting impression on the result, on the viewers and the readers who are trying to read the abstract. It is always important that you make your abstract specifically for you attract your readers and bring attention to their study. In case for a sample size, it is important to be representative of the population. For example, if you're doing a study in the refractive population, if you're doing it in terms of myopia, then you should make sure and keep in mind that myopia sample size should be not less than 500 to 1000 because of the massive size and population ratio. But in case if you're doing in pathological myopia, keeping a sample size of around 150, 100 is acceptable because the percentage of pathological myopia that you see in a common OPD is much less. So this will bring impact to your study. In regards to methodology, always do a proper literature review. Look into similar papers to see what practice about choosing the methodology is. Make sure inclusion and exclusion criteria should not be vague, and try removing as many biases as possible to make it a strong abstract. For example, if you're doing a surgical review and you're doing a paper, then you have to make sure that how many surgeons are practicing, and not make it vague that there were a number of surgeons doing the surgery and they were included in an abstract. You should make sure that there was one surgeon or two surgeons. Don't make it crisp and abstract so everyone can understand what you're trying to put across. You should always remember the result should be in sync with the hypothesis, whether it may be positive or negative. There is no particular thing that it has to be a positive result or a negative result. In conclusion, limitations should be mentioned. The objective of your abstract has to be in accordance with your abstract. Do not forget to emphasize the most important findings of your study. So in general, in the gist, what is the difference between a good abstract and a bad abstract? The length of the abstract, should be good enough to give the readers good information. Proper summarization, distinct points of aims, methods, results, and conclusions should be mentioned. In the content, it should be important and keeping in mind it's stressing on the important points and main findings. Not having focusing point makes it a bad abstract. It should be written according to the format of the journal you plan to submit it in. You should make sure that you know which journal you're planning to submit it in, so that when you're sitting and making the abstract, you're not making a vague abstract and you're going according to what the terms and conditions of the journal are. Make sure it is clear and with no grammatical errors. And in conclusion, as I said earlier, you should emphasize on the main important findings of your study. At the end, you should not stress about it. Just be calm and write an abstract, and you'll definitely do wonders. Thank you.
Thank you, Pooja. Rajesh, would you like to discuss this presentation, please?
Yeah, sure. It was nice and crisp, Pooja. Nice presentation. And she highlighted some of the points which were not covered. One thing which she mentioned was about inclusion and exclusion criteria. And that is something about which many people make an error. Like suppose you are doing a study on cross-linking on keratoconus. And so your cohort is keratoconus. So you cannot say that in exclusion criteria that you will exclude cases not having keratoconus. Rather, in exclusion criteria, you will write that you will exclude patients of keratoconus not who are having scar. So that is very important, that you have to understand what is the inclusion and exclusion criteria. That you emphasized about inclusion and exclusion. That was good. And of course, apart from that, I think most of the things have been already discussed. Thank you. Good presentation.
Thank you very much, Rajesh. Parikshit, you would have a word. Okay. Shall we go over to the next presentation? And this is Bala. We would like to introduce you, Bala.
Yeah.
Can you please
just introduce Dr. Bala Murugan. Dr. Bala Murugan is Chief of Uveitis and Ocular Inflammation at Arvind Eye Hospital, Pondicherry since 2010. He's currently Chief Editor of Uveitis Society of India and reviewer of multiple national and international journals. And he actively participates in national and international conferences in the field of uveitis all over. Over to you, Dr. Bala, for your presentation.
And after Bala's presentation, Jatinder, you, Feroz, and Dr. Santosh would request all of you to discuss.
Yeah.
Sure, sir.
Good evening, sir. Good evening, one and all. At the outset, I would like to thank AIOS Scientific Committee for giving me this wonderful opportunity to present the aspects in uveitis subspecialty on good versus bad abstracts. Lot of points have been already covered. The definition of good and bad varies with a lot of people, but broadly, we have a consensus that enlisted how a good has to look. The formula for success lies in the proper designing of the topic and the title and the motivation of the person who does the research, and specifying the problem statement and the approach to the problem, and meticulously stating the results and meaningfully correlating the conclusion with the topic and title in the conference abstract. Basically, there are 4 C's: comply with the word limit, give us clean, error-free reports, don't have any discrepancies, use clear, simple sentences, most importantly, concise or brevity is the secret of success. So what I did was the last 10 years of AIOS uveitis subspecialty abstract, I have gone through and characterized a few examples of how a good abstract should look like. The first one was if you have a study which is multi-centric, it definitely grasps attention. This was one of the beautiful abstract where the researcher collaborated with multi-institutions in US and as well as Italy, and they nicely correlated the retinal vasculitis and retinal vascular occlusion, and this grasps definitely an attention. In the methodology part, this abstract has definitely used a specific diagnostic criteria, and in the results, they have nicely used the best corrected vision specified in terms of logmer as well as the Snellen sequelae, and they have nicely characterized the vitreous hemorrhage in percentage and all the other sequelae. And meaningfully, they have concluded that it is a heterogeneous group, and there is an occlusive retinal vasculitis which requires meticulous surgery. So this definitely grabs the attention of the person who evaluates this abstract. The second thing which I learned from the review of the AIOS abstract is we tackle the felt problem in the practice. So this was again how to distinguish acute VKH from acute CSCR using a novel imaging modality called OCTA. So this is actually hitting the hotspot. So we are actually tackling the felt need of the audience, and they meaningfully concluded that OCTA has certain signs which helps in differentiating the flow void areas, the capillaries, and the choroidal ischemia. And this differentiates CSC in the acute stage. So it's really a practical, although there is a novel modality here, it really hits a hotspot, and definitely it will arouse the attention. The third thing which a good abstract should have is it should arouse the attention of an important problem. So the important problem the author here tackled was the necrotizing anti-scleritis in a tertiary care center. Definitely, this is going to grab attention, and they concluded that the cyclophosphamide is the most important, commonly used immunosuppressive. And what could be done better is they could have refined the title in a much better way, like what we get in the WhatsApp.
Sir,
media.
please conclude.
So, and yes, so we need to have. Sometimes we may not have a new problem. So even an intermediate uveitis with the region variation they could present. Sometimes we can focus on the changing practices like VKH, what has changed. So this definitely grabs attention in South India, and they've used all the contemporary imaging modalities, and they concluded that there is an usage of purely parental steroids will definitely help the audience. And sometimes hardwood wins lots. What does it mean? So this here, there is an extensive study period of more than 20 years, and they targeted the sympathetic ophthalmic in pediatric age group. This has grabbing attention, and it has won the best paper award. So sometimes we have to be novel. Here the PCR from a tertiary care center, they found out how it is useful in the infectious uveitis. The people are definitely going to be inquisitive to look into this study. And sometimes we need to focus on the neglected subpopulation like HIV, where the challenges of using the RT-PCR is illustrated. Sometimes huge international study is presented in the national conferences with a common understanding. Here there is a multi-centric study on tuberculosis of COTS data, and they have concluded PCR is not used in Indian scenario. Sometimes how not to write abstract, I'll give two illustrations. If you give too much data in parentheses, it doesn't augur well to the audience, and too much of statistics also is to be avoided. Just being novel is not enough. Sometimes we see abstracts with no data, no statistics. So just being trendy with color imaging and posterior uveitis, no data, no statistics, it doesn't augur well. And we need, sometimes we tackle the felt need, quantifying the vitreous inflammation objectively. Wonderful concept, but look how the results and methodology, too elaborate. So brevity is missing here. So this is how we do not want an abstract to be, although the topic, the concept, the hard work, everything is there. This is how the abstract shouldn't be. Thank you so much.
Thank you, Dr. Bala. Thank you very much. Excellent presentation. And I would request now Santosh, Feroz, and Bala to please discuss.
Thank you, sir. Shall I just put in some tips before the masters take over? All
Please.
right. Yes. So a few things that I would like to point out here is, writing an abstract is definitely a stepping stone to getting it accepted. So, and the reason for us conducting this is basically aimed at presenting a good abstract for paper, poster, and video for AIOS in the coming AIOS for all the audience, the delegates, be it postgraduate students or anyone else. So what I would say is few things. Most of the things have been covered. It's nothing too much extra that I'm going to speak here. It has to be very precise, and in fact, even in an abstract with 200 words or 300 words or even 100 words, it has to be organized. Starting from the title. So all of us have been talking about keeping the title very, very simple. It doesn't have to be too, fancy or anything where it's exactly, you have to represent the title regarding the study, what you really want to convey. It's a message. The title has to be a message, and it doesn't have to be fancy at all. Now, regarding the purpose is basically the research question, and that is how organized you go. And now in the methods, there are certain things that you have to always write about is basically the type of the study, the duration of the study, the primary outcome, and the secondary outcome. So in very small, words, simple words, these are the organized way of writing methods. Now, results, always it has to start with how many number of subjects or number of eyes that you are studying. Then comes the demographics, and then what is the results of your study. What you have to look into, what you have looked into, be it the primary outcome, the secondary outcome, or the tertiary outcome, if at all you have. And all these things, whenever we look into an abstract for selection, definitely statistics matter. So it just cannot be a random sentence of giving the numbers, but some amount of statistics has to be present in the results of the study. Now, conclusion is basically what there are so many results that you would have got from the study. So the conclusion has to relate to your purpose, and mostly it is always better to keep it very precise where you're talking about the primary outcome. So this is what I would consider, writing a good abstract is. But I also believe that in a video abstract, it's totally different. Paper and poster presentation abstract is slightly different from what a video abstract is. In video abstract, it's like you are actually presenting a procedure. So you have to say what you are, taking the audience through, like what is the kind of surgery surgery, what is the importance of the surgery, and how innovative your surgery is. This is what I have to say here. And in fact, I learned my abstract writing, be it for American Academy, AIOS, or any other conferences, from my mentor, Dr. Santosh Unawa. He has really taught me how to do it, and I'm so fortunate to have learned from him. I would invite Dr. Santosh Unawa to take over.
Thank you, Feroz. So before Santosh pitches in, so I would like to tell you the videos that we received last year, 404 video abstracts we received last year, and only 50 of them went up to the presentation in the AIOC. So that is the type of aspiration people have. And thank you for bringing up the video abstracts. Santosh, over to you, please.
I think everything has been covered. Yeah, go ahead.
Go ahead.
No, nothing. I just wanted to say that everything has been covered so well that I have to endorse everything that has been said so far. Title, I would actually stress on the title. I would think quite extensively about what to title a paper. It has to be very interesting. It has to arouse the interest of the reviewer, right from the beginning. So title has to be catchy. It doesn't have to be long. It should not be too short, but it has to be catchy. And just by looking at the title, somebody has to, reviewer or whoever is looking at it, has to get an impression as to what the study entails or what does the study have to offer. For example, for adenoid cystic carcinoma multimodal treatment, I would ask a question as a title. Does multimodal treatment in adenoid cystic carcinoma increase eye and life salvage? That would be a question. So the reviewer would be looking at answer in the abstract for the question that you have asked in the title. So title can be a question, and purpose has to bring in what is the lacunae in knowledge and what you're going to do. Both have to be addressed in the purpose. You cannot simply say that the purpose of the study is to analyze the 100 cases of ptosis. That is not the purpose. But what were you looking for by doing that study should be addressed in the purpose, which should be very briefly so. And the method, as Feroz and others pointed out, it has to address the type of the study that has been undertaken, the setting of the study, but without disclosing the identity of the person who has done the study or the institute. In many of the abstracts, you find the mention of the institute or clues to the mention of the institute. For example, a prominent eye institute in Chennai would mean only 4 or 5. Right, so we should not do that because that loses the sanctity of evaluation because it's blinded. Ethics approval has to be part of the methods. Currently, I think that has become very important that we should have either the ethics committee approval or for a randomized trial CTRI registration. Both need to be mentioned without having to mention the number. We should mention that the study had been approved by the ethics committee or appropriate authorities, especially if it's an experimental study, such as gene therapy, etc., then approvals are important and that should be part of the abstract. Results have to be succinct, but due weightage has to be given to mentioning the appropriate statistical method that has been used and the statistical validations of the study. And the conclusion should always be based on the results. There should be no extrapolation or speculative sentence in the conclusion. It should be straight based on the primary or secondary outcome measure that has been addressed in the results. That's it.
Thank you very much, Santosh.
Yeah, I think very nicely covered most of the points, as very rightly previous speakers and the experts. I think the two main important of the abstract is one is title, which really reflects the purpose of the study. Title has to be very clearly worded. It has to be precise. It may not be very flamboyant in the wordings. And the second most important part are the results. Results should indicate what your research question was. It should simply answer your research question, indicating the number of patients or the number of eyes, and also including the statistical significance, statistical methods used. And the conclusion, very rightly pointed out, should be according to the research question which has been answered, and no extrapolation. Whatever you had answered, I'll just like to share screen and indicate one bad abstract. Yeah. Now, like in this, the title of the study is not providing complete information of the study. And in the purpose also, it is all jumbled up. It is so crowded that it's very difficult to exactly point out what is the main purpose of the study, what is the research question that needs to be answered. It could have been really done in a very brief manner. And then aims and objectives, although it has been written properly, but it is, I think this could also have been really done in a very brief manner, so that only the important points which the research question that has been framed should be answered, instead of including all the parameters. Only the important parameters which are significant to the relevance and title of the studies could have been answered. And in the methods also, like what has been done, although it is accurate, but then if you see the results and conclusion, again, all the parameters like mean angle, the trabecular iris surface area, anterior chamber angle. So the interest of the viewer is totally lost. So only the important parameters like anterior chamber depth, the anterior angle opening distance 500, 750, only the important points which are really significant could have been answered. And then if you see the conclusion, what has been done is that it is too brief. What the title, what the research question was framed, and what the conclusion that has been arrived, I think they are not in sync with each other. So very rightly pointed out by all the experts, the conclusion should be able to answer your research question, and it should not be extrapolation. Right. I'll just end my presentation here.
Thank you very much, Bala. I would request our chairpersons, Dr. Arvind sir, Dr. Barun Naik, to Dr. Surendra Pandav sir, to give your last comments.
So can I just add one point here, sir? Regarding the results, it's just to point out, like at the end of the result, it's very, very important to mention the follow-up duration, because, that really shows us the, how well the study has been done. So follow-up duration is very, very important. So it can be the last line of your results apart from all the findings. Yeah. Thank you.
Harmanshal sir.
Yeah, hi Partha. Thank you very much for bringing out in a very nice manner. It is very, very educative and informative actually. I learned a lot today. And I'm sure if the youngsters watch it, it will be very, very useful for them. So really those who had done a tremendous work in the field of writing, publishing, and doing the instruction courses, you have really included them. So it was overall excellent program. Thank you very much for bringing up such a good program to the Indian ophthalmologists. Thank you very much, Partha. And
thank you very much. Thank you, sir. Surendra Pandav sir.
Thank you. I think a lot of discussions have happened, and a very useful discussion, I would say. And I think I must congratulate you for organizing this program, because I don't remember any, earlier any program like this where this probably will be the most useful program which I have attended, participated in, and many people who are joining us online, I think they're all going to be benefited with this, because this is a key activity from academics point of view. I think the abstract is very important. It is the first step, I would say, is the stepping stone to a presentation or a paper, whether video or oral or even for a poster. So I think this is very important to get, how to write a good, abstract, and how, what are the different components to understand different parts of the, the abstract, and, do give an appropriate attention. So I think I personally have learned a lot, from different views, and I must congratulate you once again for organizing this program. I think this is wonderful. All presentations were great and very well presented, very well discussed. And thank you very much.
Thank you very much. Thank you. Dr. Rishi Swarup, and anybody else would like to comment before Dr. Barun Naik finally gives his final comments? Rishi, any of our scientific committee members, please. Amit.
Partha, I would like just to say that I hope we have created good insight among all our submitters for the coming AIOS conference. Still the date is left. We have 15th September as the last date for abstract submission for our paper, poster, physical poster, e-poster, videos. So after attending this particular webinar, I think we should send a flyer to all the AIOS members now that before you submit your abstract, please go through this program on YouTube or Facebook. Learn how to submit the abstract. Let's just not increase the volume and the burden of the evaluators. Let's submit good scientific abstracts and let's hit the need. That's what I would like to say.
Thank you. Parikshit?
You're muted, Parikshit. You're not audible, Parikshit. You're not audible.
I hope that more people submit the abstract, so the burden of the evaluators actually increases and they have to evaluate more of them. But yes, it will go a long way. It is a brilliant idea by Partha sir, and with such a great panel. We need good abstracts, not just for AIOS, but for all the meetings.
Quite correct. I think one point that was still leaves to be highlighted is the fact that the abstract should be submitted earlier than that last date, that last hour, and that last minute. Because when you look into the abstracts, so an evaluator, and we have 30 evaluators in different sections. So if Santosh is evaluating oculoplasty and he has 152 abstracts to evaluate, so by the time he gets to the 152nd abstract, he is definitely drained out with the burden of the evaluation. So I think a very important point is, if the study is in place, if the results are in place, if everything is in place, abstract submission should be as soon as possible for any meeting or for any publication as well.
So we are expecting very good quality abstracts this year. Keep it really simple, get it organized, and hope the evaluators and reviewers doesn't have to have a Webster's dictionary also beside them. So keep it really, really simple, to the point and precise. Thank you.
Rishi, any comments, please?
Yeah, I think if you, Dr. Barunayak sir, Dr. Pandav, Dr. Harbanslal, and Dr. Santosh all stressed on the novelty of the topics as one of the things, as the title. I think if you have to take clue about the novelty of the title and the subject, you can take clue from the topics of the webinars of Scientific Committee. That this is absolutely novel topic, and this has never been covered before. And I think it's a brilliant concept. And it's really practically useful to all the attendees and the prospective abstract submitters.
Rishi?
I'd like to congratulate Dr. Partha on coming up with something so unique, and of course the entire scientific committee. I haven't seen this anywhere, and I think it's a brilliant idea. And the quality of abstracts is certainly going to be much better, I'm sure, and going to make your job easier, Dr. Partha.
All the evaluators.
Either easier or more difficult.
You are one of the evaluators, Rishi. So your job is going to become tough with the number of abstracts pouring in.
So Dr. Partha, everything has been covered. Just to reveal one magician's trick or one reviewer's trick is that if it's a bad abstract, it doesn't take more than 30 seconds to reject it. So I think all the submitters should make it very difficult for us and very hard for all the reviewers, because they have to go through all the 150 abstracts well, because nothing will be a bad one. So they'll follow this program and they'll all be good abstracts.
I think, Partha, we should send a mailer with the link of this program to all our AIOS members soon.
I think that's a very good idea, Amit. Very good idea, yes. Barun Naik, sir, sir, your last comment, sir.
Yeah, first of all, Partha, I must congratulate you on this topic, because these are the topics which means, and say any appreciation doesn't come easily from me. So this program was really, I always used to feel that especially people are lacking in preparing abstract, in preparing abstract, even in writing papers for journal. So some of the points is really very nicely highlighted, but 1, 2, 3 points just I want to again re-emphasize that abstract writing is not something which is just easy thing, and especially for the conference abstract, because in paper the word count is usually 250 words for the research paper, original paper. But for the conference programs, the abstract very limited number, either 1,000 word count or 100 or 150 word count. So you have to fit in any space or any word you should not unnecessarily use, and unnecessary don't exhaust that limit by writing unnecessary things and flowery language. So everything has a meaning, whatever you write. And but one thing which probably no one highlighted, everyone said good research, good abstract, good abstract, good abstract. But before that, it has to be a good research, because I notice, and which Partha also emphasized, that last day people start submitting and we get a lot of submission of abstract. But why this happens, I don't know. But many times I see many doctors, they say, last date aa raha hai, jaldi hai, mere ko abstract submit karna hai. And then they have not even missed. I don't know whether they have done any study or they just want to cook up something and then write abstract and submit it. So that kind of hurriedly planned anything, or sometimes one thing which again, as one speaker highlighted, I think the first Manisha, that the result should always show the numbers and analysis. The statistical analysis should not be just results will be presented, or the results will be analyzed and outcome will be presented. Because if you have not already taken out those results and analyzed, then how can you come to conclusion? What is your conclusion? So that part. And last point I want to emphasize, because one speaker, I think Balakrishna, highlighted that point about inclusion, exclusion, which Rajesh also emphasized in his comment. But that is really very important. And when in the result, if the space permits, say in abstract section of the paper, definitely those things, there is some scope for extra word. Extra word means the limit is 250 word. But in scientific committees programs, that kind of a space is not there. So there you should also miss, because all the reader, all the those who are listeners or the audience or the readers should be able to judge where this result is going to be extrapolated properly. Because if you write that so many patients were taken and so many patients we planned, and in that planning you write inclusion criteria, and Rajesh very nicely pointed out that suppose you say we will take a senile cataract patient, the inclusion criteria was senile cataract between the age of 40 and 60. And then in exclusion criteria, you said traumatic cataract, secondary cataract were excluded. Are Baba, this, how can you include that before, unless only once you have in your that initial criteria, if someone fits in, then only out of that, because suppose if you say, okay, out of that, all those who had diabetes, we excluded them. It is understandable. So those kind of, or say this type of cataract were excluded. But also in the result section, you should write, because this is definitely, if space permits in full text, definitely yes, you should write the total, how many patients did you screen. Suppose you screened only, means you got finally studied 100, but you screened 1,000 patients. Out of that, also mention out of 1,000 we got this much which satisfied inclusion exclusion criteria, which will be definitely more than your actual number, final number. So suppose that inclusion criteria was 120, then out of 120, how many were excluded because of this exclusion criteria, and you always forget that if something, some post-operative, during operative complications or post-operative complications were excluded, but how many had those complications that you don't mention. So that also you should mention. So reader should get the correct idea that this you have studied in 100. Suppose you started the study with 150 and ultimately you are presenting result of only 75, dropout also you are not mentioning, then that means you are trying to, means your data is not really, I will not say genuine, but at least as a reader, I will not be able to understand whether what is the robustness of this analysis. So these are the points. Otherwise, all these points, whatever was highlighted was really fantastic. And I'm sure people should attend these kind of programs more often. And I like these kind of programs more. That's why I even agreed to participate in this. And what Amit Porwal suggested, definitely you should send this flyer that please read this, please visit this program and watch this before submitting your abstract. So then definitely it will improve your quality and the substance. Thank you.
Thank you very much, sir. Thank you for all the kind words and the very honest appraisal. And I wish to thank, on behalf of the entire scientific committee, that all of you have spent time and effort, and especially on a Sunday evening, to our chairperson especially, and our presenters who brought in all those very, very important points. Thank you very much, and good night. Good night to every one of you.